You may remember last year we introduced a new organization to our community, and I'm going to read this so I don't get it wrong, but we had Rebecca Fairman. She's here from Connections for Mental Wellness, and she was here last year as well. This is a community-wide collective impact initiative in Brown County that brings together and facilitates diverse groups of stakeholders, such as nonprofits, government, education, organization, employers, and health systems to address the community needs related to mental wellness and mental health care. One of the startling things that struck out to me last year during Rebecca's presentation was that us as employees or even leaders felt really unequipped or unprepared to talk about mental well-being at the workplace. And so we invited Rebecca back to share with us new tools and updates that Connections has to have these conversations about mental health. Would you welcome Rebecca Fairman, Executive Director of Connections for Mental Wellness. This is the clicker.
To make sure I know which one's which.
Right.
Good morning. I'm going to go ahead and use this one if you would like to sit back. Thank you. Mike and Jody, thank you for that. That was absolutely fantastic, and what you said just resonates, I'm sure, so much with all of us. My coworker and I, who's somewhere back here, just had this conversation last week, talking about how much we want to do for the community, but also realizing it's really important to step back and make sure that you're taking care of yourself before you can take care of anyone else. So thank you. And they were really a great precursor for what I want to talk about today. Here's the reality. Mental health in the workplace can no longer be overlooked. It has to become a priority. We cannot deny the numbers anymore. In the United States, the economic impact of depression alone is $210 billion with a B dollars annually. I am not a Spartan. Sorry, I was a pirate. In our nation, 105 adults live with a one in five adults, working adults, are living with a mental health condition. Yet 60% of these individuals do not receive treatment for mental health. Bringing it closer to home, in Brown County, 33% of adults report at least one poor mental health day per month, and 12% of employed adults report 10 plus mental health days per month, greater than 10 mental health days. 12% of employed, I'm repeating myself. 93% of adults who died by suicide in 2016 were employed. 93%. So what does this look like in real numbers for employees? For those who did report 10 or more poor mental health days, this equates to over 1,407,000 poor mental health days per year. And because of absenteeism and presenteeism, which is essentially when you do have an employee who shows up for work but is really struggling, so they're not really at their most productive, the true impact, the annual cost of poor mental health days within Brown County is $400 million. That's the cost of poor mental health in Brown County alone. So obviously the clear takeaway from all of this, and the same thing that Jody and Mike talked about, is employees' positive mental health equates to organizational well-being and better business performance. So where do we start with that is often the conversation. How do we start to implement these and put them into place? There are really three essential components for starting that. We have to have preventative strategies and programs to build a thriving workforce. We need to ensure positive and appropriate interventions, and appropriate is really key there. I know a lot of times as we talk within our workplace work group, people are often very concerned about what would be appropriate. Should we intervene? What's the liability in that? And most importantly, we need trainings for managers and frontline staff so that when they recognize or see a mental health issue or an incident or a crisis taking place, they feel prepared to address those issues. So how do we do this? We begin by developing and implementing policies and practices that promote mental wellness and increase productivity and retention, which in turn will lead to a reduction in these mental health care costs and the absenteeism. We can begin this process through the use of a recognized successful model, the ICU program. Often the most difficult part of addressing the mental health care needs of employees is finding just the right model to begin to put mental wellness practices and policies in place to start that conversation. So I share with you a simple, user-friendly, evidence-based tool to raise awareness and begin implementing these policies and practices within your workplace, creating that culture of the safe space. The ICU model was actually developed in 2011 by DuPont companies, and they implemented the model to 70,000 employees worldwide. It was such a successful program that they turned around then and donated the partnership, or donated the program to the Partnership for Workplace Mental Health for use by other employers. And it's available at just the right price for everyone, free. It is free to download this model and implement the guide. Imagine someone arriving at work with a broken leg. Everyone gathers around and they ask what happened, and they offer to carry his or her things. They ask what they can do. They offer to help doing whatever they can to lighten their workload. They show compassion for their needs, and they seek ways to help. Maybe a coworker with a close relationship even offers to bring a casserole to help them with their needs at home. They do what they can to ease their burden. But if someone shows up to work and they're withdrawn, they're upset, they very obviously are depressed, or they're just not acting like themselves, the reaction of the coworkers is quite often the opposite. They'll turn their backs. They're unsure of what to say or do, and they do not even know how to offer help. And so that individual tends to be even more isolated. Mental illness is not a casserole illness. The ICU program offers guidance, and it demonstrates a path to identifying the signs of distress, connecting with the person who's experiencing that distress, and understanding the way forward through referrals to current internal programs, or discovering and referring to new and existing external programs. The ICU model has recently been implemented by a large local company here in Green Bay with over 500 employees. Following the implementation of the program, 70% stated that they increased their knowledge of available resources, and they felt comfortable referring a peer for help when he or she was experiencing a mental health issue. The human resource manager for this company stated the following: "The ICU model was a great resource. I was able to use the tools and the videos to adapt to fit my own organization." Response from employees was really positive. Some of the comments were, "It's so nice to learn what's available. I'm glad we're talking about mental health at work." The ICU provided a framework for presenting the resources we have at our fingertips and for opening a dialogue about mental health at work. This is a large local company, and the individuals were so grateful just to have that opportunity and have someone speak to them and say, "We understand, we know, we get that work-life balance." Since that time within the company, they have actually, through just one of the employees who that conversation really struck home, they've started an internal blog where many of the peers have shared their stories, and thereby raising the awareness and helping to reduce that stigma around mental health issues. The core component of the model is a 5-minute video. This teaches employees and managers how to recognize distressed peers and how to connect with them. It's designed to work in tandem with your current already existing programs that are available. It does not replace them or duplicate these services. It simply helps to point them out again as a reminder that they're available and that you as employers, as human resource managers, and even as peers, care about other people's mental health and understand that it's so important for the company as well. This is a demonstrated, successful, user-friendly, evidence-based model. Even Bellin Health had implemented and used this model in the program. It was recently utilized also by Foundations Health and Wholeness, and Brown County United Way will be rolling out the program in the next couple of months. And there are several other local businesses that are on board to finish this up. I say finish this up because Carla's going wrap it up and I'm about halfway through, so let me buzz through. The benefits to using the ICU program, you can tailor the guide right to your own company, put in your own branding guidelines, and it provides a way to really get buy-in. And most importantly, there is a guide attached to it that really helps to sustain the message and carry that mental health culture forward and continue it within the workplace. Some additional tools to help connect within your workplace is the Mental Health First Aid Program. This was developed in Australia back in 2001, and since that time, over 2.6 million first aiders have been trained. What Jody Anderson, who spoke recently, is a certified trainer, as am I, and we work together to teach individuals about the mental health first aid model. The training is really providing an overview of recognizing and understanding diagnosable mental health issues and a plan to help those in distress. If you're interested in hearing more about the program, or interested in possibly bringing the training right into your workplace, please come and see me after the program and we can give you a flyer about some upcoming dates or how you can implement this internally. Another additional tool to help you connect is the myconnectionnew.org website. It is an amazing website brought to you through a partnership of some phenomenal partners that you see up there on the screen. It provides a one-stop shop for all things mental health, substance use related, and the information is for Brown, Calumet, Outagamie, and Winnebago County. This is an amazing tool. It really provides just a wealth of information, many of which you see up on the screen and additional. Anyone who has a concern about themselves, a friend, a loved one, just going into this website is an excellent way to start to look up some resources that are available. I also have some posters, cards, and information about that as well. And so, thank you so much for having me here today. I am really excited to see events like this and this many people gather around and start that conversation about mental health and mental wellness within the schools, within the workplace. And again, I encourage you just to stop by with me afterwards, start that conversation. And we'd love to start working with you and helping to give you the tools to bring that back to your offices and start the conversation. Thank you.